Center Test Prep Exam Booster. Question 1. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Elevated serum creatinine and blood urea nitrogen, BUN, are the hallmark lab findings of acute kidney injury, reflecting decreased glomerular filtration rate. Question 2. In a multiple casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is: option A, green, minor; option B, yellow, delayed; option C, red, immediate; option D, black, deceased/expectant. The correct answer is option C, red, immediate. The START triage system categorizes this patient as red, immediate. Respiratory rate, 30 and altered mental status, doesn't follow commands, are both criteria for red. The presence of a radial pulse is a positive finding but does not downgrade the urgency. Question 3. The most critical treatment for a patient with heat stroke is: option A, oral rehydration with electrolyte solution; option B, rapid cooling to a core temperature below 39 degrees Celsius, 102 degrees Fahrenheit; option C, administration of antipyretics; option D, active external rewarming. The correct answer is option B, rapid cooling to a core temperature below 39 degrees Celsius, 102 degrees Fahrenheit. Heat stroke is a life-threatening emergency defined by hypothermia, usually 40 degrees C/104 degree F, with CNS dysfunction. Immediate, aggressive cooling is the definitive treatment. Antipyretics are not effective. Question 4. Which assessment finding is consistent with a flail chest? Option A, crepitus over the sternum; option B, paradoxical chest wall movement; option C, trickle deviation; option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Flail chest occurs when two or more adjacent ribs are fractured in multiple places, creating a free-floating segment. The segment moves paradoxically, inward during inspiration, outward during expiration. Question 5. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: option A, insert a urinary catheter immediately; option B, perform a retrograde urethrogram before catheter insertion; option C, irrigate the bladder with normal saline; option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Blood at the urethral meatus is a classic sign of urethral injury. A retrograde urethrogram must be performed to assess urethral integrity prior to any catheter insertion attempt. Question 6. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates: option A, damage above the midbrain; option B, damage at or below the midbrain/brainstem; option C, damage to the cerebral cortex; option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Decerebrate posturing, abnormal extension, arms adducted and internally rotated, legs extended, indicates brainstem damage below the level of the red nucleus and carries a poorer prognosis than decorticate posturing. Question 7. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is: option A, 250 ml of 0.9% normal saline; option B, 500 ml of D5W; option C, at least 30 ml/kg of isotonic crystalloid; option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Current guidelines recommend an initial bolus of at least 30 ml/kg of 4-isotonic crystalloid solution, for example, normal saline or lactated ringers, for patients with sepsis-induced hypoperfusion or septic shock. Question 8. The hallmark sign of compartment syndrome is option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding. Question 9. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option B, bowel obstruction. The classic presentation of a small bowel obstruction includes cramping pain, abdominal distension, nausea/vomiting, and early high-pitched, hyperactive bowel sounds, borborygmy, that become absent later. Question 10. The priority patient for a trauma team activation based on mechanism of injury is option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Ejection from a motor vehicle is a high-risk mechanism of injury that alone warrants trauma team activation and comprehensive evaluation, regardless of initial vital signs. Question 11. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is option A, absent breath sounds. Option B, dullness to percussion on the affected side. Option C, trickle deviation. Option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. With hemothorax, blood in the pleural space, percussion produces dullness due to fluid. In pneumothorax produces hyperresonance due to air. Both cause decreased breath sounds. Question 12. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. The nurse has an ethical and legal duty to report suspected impairment or diversion to the appropriate supervisor immediately. Confrontation can escalate the situation and compromise the investigation. Question 13. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out life-threatening ectopic pregnancy before other diagnoses are considered. Question 14. The safe harbor provision for nurses typically refers to option A law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Safe harbor laws allow a nurse to accept an assignment they believe is unsafe but to invoke a formal review process that provides a degree of protection from licensure action or employer retaliation. Question 15. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, immediate endotracheal intubation. Option D, neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. A GCS of 8 or less indicates severe brain injury and an inability to protect the airway. The patient should be intubated for airway protection. Question 16. The golden hour for acute ischemic stroke refers to the window for: option A, completion of an MRI, option B, administration of 4 thrombolytics, TPA, option C, achievement of blood pressure control, option D, initiation of physical therapy. The correct answer is option B, administration of 4 thrombolytics, TPA. The golden hour in stroke care refers to the critical importance of rapid assessment and treatment. For TPA is generally indicated within 3-4.5 hours of symptom onset in eligible patients. Question 17. Priapism is a urological emergency characterized by: option A, painful, prolonged erection, option B, inability to void, option C, testicular torsion, option D, scrotal edema. The correct answer is option A, painful, prolonged erection. Priapism is a sustained, often painful erection lasting more than 4 hours unrelated to sexual stimulation. It requires emergency intervention to prevent permanent erectile dysfunction. Question 18. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock, option B, distributive shock, option C, cardiogenic shock, option D, neurogenic shock. The correct answer is option C, cardiogenic shock. In cardiogenic shock, the pump fails, leading to decreased cardiac output. The compensatory vasoconstriction increases SVR, cool, clammy skin, and preload backs up, causing JVD and pulmonary edema. Question 19. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents: option A, uncompensated respiratory acidosis, option B, compensated respiratory acidosis, option C, uncompensated metabolic acidosis, option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. The low pH, acidosis, with elevated PaCO2, respiratory component, and normal HCO3, no metabolic compensation yet, indicates an acute, uncompensated respiratory acidosis. Question 20. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is: option A, diltiazem, option B, verapamil, option C, metoprolol, option D, digoxin. The correct answer is option D, digoxin. Digoxin can be used for rate control in atrial fibrillation, particularly in patients with heart failure. Non-dihydropyridine calcium channel blockers, diltiazem, verapamil, are typically avoided in FREEF due to their negative inotropic effects. Beta blockers may be used, but digoxin is often preferred as an adjunct or alternative. Question 21. A patient with a spinal cord injury at T1 is bradycardic and hypertensive. This is characteristic of: option A, hemorrhagic shock, option B, cardiogenic shock, option C, neurogenic shock, option D, septic shock. The correct answer is option C, neurogenic shock. The loss of sympathetic innervation in neurogenic shock results in unopposed parasympathetic activity, causing vasodilation, hypotension, and bradycardia. Warm, dry skin below the level of injury is also characteristic. Question 22. The antidote for acetaminophen overdose is: option F, naloxone, option B, N-acetylcysteine, option C, flumazenil, option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. N-acetylcysteine, NAC, replenishes glutathione stores in the liver, allowing for the safe metabolism of the toxic acetaminophen metabolite NAPCHI. It is most effective within 8 to 10 hours of ingestion. Question 23. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: option A, forcing oral fluids, option B, straining all urine, option C, pain management, Option D, surgical consultation. The correct answer is option C, pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 24. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, US citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. EMTALA mandates that any individual presenting to a Medicare participating hospital with an emergency department must receive a medical screening examination, regardless of ability to pay, insurance status, or citizenship. Question 25. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils. Option B, a unilaterally dilated and fixed pupil. Option C, bilateral mid-position and fixed pupils. Option D, constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. As the uncus hernates through the tentorial notch, it compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed, blown pupil.